Okay, I have 102. I say we get started. Good afternoon. How's everyone doing? So I always like a challenge. They gave me the slot right after lunch, windowless room, but I have faith. Anyway, I'm Tom Laurie. They gave me this fancy title. I'm Director of Worldwide Health. And what that really means is I have the privilege of working specifically in healthcare around the world. In the last 6 months, I've worked on analytic projects in 12 countries. So it's a great gig. And my main focus is taking our analytic and data solutions and driving it into healthcare. So I have the opportunity to work with everyone from providers, payers, life science, health ministries, a lot of our partners who are either in healthcare and analytics or wanting to get in. So that's what I do. So very quickly, how many of you in some way directly work for a healthcare organization? Okay, providers, payers, partners who serve healthcare, life science. I think I saw at least one dental that we'll call them out as a special category. There you go. Okay, good. So in the next hour, I've got about 173 slides I want to get through, so I'm going to go fast. No, so here's what I'd like to propose because your time's valuable. I've got a few slides that kind of define in general the opportunities for advanced analytics to change healthcare. I will touch on some things that are specific to machine learning, mainly around Azure machine learning. And then I'll roll to some other things. As I was talking to some of you, you came in, you're either using or wanting to use more on things like Power BI. We've got this what I call a framework called Cortana Analytics. But we frankly kind of confused people when we first announced that. It's not a new product so much as it's a framework that allows us to better rationalize all those cool things we're doing and all those cool things that are coming. So I'll do a few slides, a few specific examples for machine learning, and then I'll roll to, time permitting, and if you all are still in the room, I'll do some real demos that are based on real data, real use cases, and real products. So does that feel like what you signed up for? Okay, good. Is there anything, I always ask this, and in America, usually people are not shy. In Europe, I never get an answer. Is there anything you want to really make sure I cover in the next hour that's a good use of your time? Yes, sir. The gentleman from Scripps.
Streaming data.
Say that again?
Streaming data.
Streaming data. Okay, okay. All right. Streaming. All right, anything else? Yes, sir. HIPAA, I've heard of that. For those of you who don't know, there are a few regulations on security and compliance in healthcare. Here it's HIPAA, Europe it's some of the EU standards. Okay, anything else? Okay, I'm gonna start driving slides. So I'm gonna start with a confession because they say confession cleanses the soul. I brought you here under false pretenses, I really did. So this title slide I used because I knew if I used the one I wanted, they wouldn't have let me have a session. So the real title of this session is Using Your Talent to Make the World a Healthier, Better Place. So here's my premise. Healthcare is one of the biggest economic and social challenges of our time. I mean, everyone would agree with that. Everywhere in the world I go, huge challenges, both economically and as a social challenge. Everyone's struggling with rising costs and uneven quality. Anyone here from outside the United States? I think this is a US crowd. So in the okay, gentleman in the back, where are you from? Canada. Oh yeah. Aren't you guys part of what? No. You're sitting in the back because you're Canadian, because you guys are so polite. And
sitting in the back because you're jealous of our healthcare system.
Okay, there you go. You just didn't want to be by the door when everyone rushes you to talk about that. So no, so in the United States, and Canada does have, you got a few problems, but you got some good things going. So in the United States, we spend 20% of our GDP on healthcare. And what's interesting is, and then on uneven quality, so if medical errors in the United States were classified as a disease, it would be the third largest killer after cardiovascular and cancer. So when was the last time you saw a telethon about medical errors? So I mean, we've got huge issues. We've got great people, great health systems. We have huge issues. Health leaders are trying to do things that I think are incremental fixes. None realistically have had much impact. And so our premise is we believe it's time for something new, which is where everyone in this room comes in. My premise is, as you look at the change needed anywhere, that we have as big a role to play in using technology to innovate the way healthcare is done than any clinician, any healthcare executive. And I firmly believe that, and hopefully you do too, which is why you're here. So think about this. Strip away all the complexities of healthcare here, Canada, anywhere. But think about any process in a doctor's office, a hospital. Most of what everything is geared towards is gathering and generating data. So your x-ray, your lab test, your physical exam, your genomic sequence. It's all about, hey, let's get some more data. We use that information to make decisions. What's wrong with you? What to do to make it right? How to keep you from getting sick? How to help you be healthy for the entire time you have on this planet? I mean, it's pretty simple, really. Now, the problem, I've never been anywhere where someone says, you know, the problem with healthcare is we don't have enough data. If any of you believe that, I want to talk to you because I don't know what planet you come from. But the problem is that we don't have, it's not that we have too little data, it's that we have too much data not being used. It's in many places. It's hard to get to, particularly when it's needed to do good. And any of you who work in a provider or payer organization and are charged with wrestling all that data to try and do good, you know what I'm talking about. So the simple truth is we believe you can do better. We can collectively do better. And those of us who are the technologists are a big part of the solution. So the beauty of what's happening in the world today, so in healthcare today around the world, medical information is doubling every 24 months. There's one study that says by the year 2020, medical and health data will double about every 90 days. So think about as much data as we have now, the trajectory of 24 months from now, if you're back for, I think this is the inaugural conference, the third annual conference, we'll be sitting here and data will have doubled, which is a lot of what you get to manage. That's before you even talk about all the other data not considered medical data. So when we look at the world of opportunities for advanced analytics in healthcare, most organizations, I mean, check me on this, they think of clinical data, they think of claims and cost data. If you're a certain type of organization or a big academic medical center, you're dealing with pharma and life science. But increasingly, you have things like patient and citizen data. I mean, all the things such as social media. You have what we call geosocial environmental data, such as weather patterns, a lot of things. And the idea here is, what do we do with this data and the right tool to break down the boundaries? So many times when I get to work with health leaders, clinical leaders, health executives, who are not technology oriented, but they're there charged with solving these big problems, we have trained them to basically think in these silos that the information is contained in. But the premise I want you thinking about is the next time you're either in your organization or your partner trying to work with a healthcare client, and they're talking about a problem, I want you to pull back and say, how would we solve this if there were no boundaries to data? I could take any data from anywhere, internal, external, bring it together in a useful manner. How would that change the way you approach problem solving? I'll show you a couple of examples in a second, so it's not just me up here talking. So that's the overall premise. Let me shift gears now and touch on a few examples of machine learning. Everything I'm going to show you is really driven by what we call Azure Machine Learning, part of Cortana Analytics, the framework. At the same time, though, I'm really excited about machine learning and what we're doing with AML. Everywhere I go around the world, everyone talks about wanting to do predictive analytics. They want to predict everything. But the reality is, in the traditional realm of machine learning and algorithm development, it's hard, it takes very talented, hard to find people, and it's expensive. We believe at Microsoft, until it can be much more agile at a much lower price point, you're still going to need the PhD data scientists. If any of you are PhD data scientists, I guarantee you've got lifetime employment. But the idea is, how do we make it easier to develop those things with talent that maybe aren't PhDs to do more and free up the sophisticated data scientists to do the higher level work they want to do anyway. That's the premise of Azure Machine Learning. It's cloud-based. If you're saying, hey, my organization has a policy over which says over my cold, dead body, are we putting information in the cloud? Fine. I'd love to have that conversation about where you think you'll be in 3 years. But if that's the case, it's like, well, let me show you all of the cool things you can do with things like R. And we acquired this amazingly cool company about a year ago called Revolution Analytics. The idea at Microsoft is, machine learning that's agile, cost-effective, and fits where you are now, and then hopefully gives you a line of sight to say, if we're not ready to do that in the cloud, fine. Let's look at what we can do with R. Let's look at what we can do with some of the new cool things coming in SQL 2016. Eventually, then, when you're ready to move to the cloud, we can. So this first example is from a colleague of mine out of Microsoft Research in Cambridge, and it's the only video I have, and it's much more entertaining than I am, so let me just play this.
The healthcare industry has got a lot of technology, and yet we feel that we're not making the best use of that technology and that data.
We saw a real possibility to use all of the expertise that we have in the building around machine learning, computer vision, to assess and diagnose the progression of multiple sclerosis.
Multiple sclerosis is currently assessed by a neurologist using a clinical standardized rating scale. And this is where technology has a real strength.
The role of machine learning is to find an automated way to classify the patient's condition given a certain set of movements.
We're not trying to replace a neurologist or the nurse. What we're trying to do instead is to provide some data that's going to help the expert make a better assessment.
We worked with a team at Novartis Pharma AG who helped us understand what kinds of things are needed in clinical trials and how it is that we go about partnering with clinics.
What we've been able to do in this collaboration is work with university hospitals, Microsoft Research, as well as our own Novartis research teams to bring together the best talent needed to completely change the paradigm.
SSMS system provides a consistent quantified measure of motor ability over time. It's there to really help the doctor, to help the patient to make the best decisions they can about their treatment.
How many of you right now are either using or starting to look at using Azure Machine Learning? I guess you don't have to raise your hand if you don't want to. Okay. How many of you are doing some type of machine learning now using other methodologies? Okay. Good to know. How many of you want to move further into predictive analytics? This is an unofficial, again, everywhere I go, people kind of look at the line of sight of where they are and the new innovations, and anyway, you just validated some things that I'm also seeing. So a couple of other quick examples. That was kind of a bit of a Hollywood video, and it really is cool stuff. The whole premise is we're not trying to replace clinicians and what they do, because I don't know that you can ever do that. There's another big company that's doing this big thing around cognitive computing where they keep talking about they're sending their cognitive computer to medical school, and I always chuckle at that. It's like, really? Anyway, there's another whole presentation I do on correlation versus causation, and there's a big difference there. But anyway, this is a quick example of a partner that's a small partner right now, actually based here in Seattle. They're a recent spinoff of University of Washington, and they're doing advanced analytics specific to health. So they took Azure Machine Learning, they took a database from a payer organization, so past claims and all the demographics with it, and they used Azure Machine Learning to say, what if we could take the data on these patients and then on a go-forward basis predict which patients are going to be the highest cost patients in the coming year. So they used this for with Azure Machine Learning. They spun this up, and if any of you are into actuarial sciences or payer things, where you go, well, the 75-year-old male who had open heart and a hip replacement in the last year, I can predict is going to be a high-cost patient next year. But what this is doing is showing unrecognized trends that you probably wouldn't see. So in this case, this is a live example where, I just went in and started picking, but here's a 49-year-old male that the previous year cost about $10,000. They're predicting is going to cost almost $90,000. So some of it's economic, But that dollar amount is a proxy for there's something really bad that's probably going to happen to that 49-year-old male. So the idea is, what if you could predict based on an individual patient? What if you can do the same thing by predicting these are the highest risk patients that are either, you know, I'm an accountable care organization in America and I'm at risk to manage their health. And then the cool thing that they're playing with is not only doing predictions, but saying here are some of the comorbidities and factors that if we control, so you can select what if we did a better job of managing fluids and electrolytes, and then it recalculates the estimated cost, which is also a proxy for, you know, less severe, better able to manage. So imagine being able to mine data proactively and get out ahead of, you know, the things that are going to happen to people in a proactive way at a much higher reliability than what you might be doing now. So one quick example. I love this example. Sweden is one of the coolest places for innovation and use of analytics, but Karolinska is like the Mayo Clinic of Sweden. Shortly before we did general release of Azure Machine Learning, they grabbed it and started playing with it with a partner. So this was another small partner working with Karolinska. And basically, I love this. It was like the Indiana Jones of analytics, where they said, hey, 25 years ago, we created a database to see if we could predict which children, when they reach reading age, will have reading disabilities. So 25 years ago, they developed this database. They did all kinds of testing. They couldn't do anything. They dusted it off, cracked open the data, ran it through machine learning, and literally in a matter of a couple of weeks, were able to come up with algorithms where they sit a child in front of a computer, they read a standard amount of text, and in 60 seconds with 90% accuracy can predict which children will have a reading disability and correlate that to the likely cause. So any of you who have kids, think about when they reach that point where they're ready to read and there's a problem and you could identify it early. I mean, think about the implications for the rest of their lives. So they did this with Azure Machine Learning, literally 25-year-old database, 90% accuracy. So they're now updating the database and they're looking at implementing this in the school systems throughout Stockholm County. Finally, another kind of cool thing out of Norway where, you know, everyone's talking about climate change, including our president, and the impact on public health. So in Norway, all healthcare is run by what are known as health authorities. There are 4 health authorities that run all the doctor's offices, all the hospitals. The largest one that manages about 50% of the population's health. They've got some really cool kind of wacky analysts, and they came to us and said, hey, we want your help. We want to use Azure Machine Learning because we've got massive amounts of weather data down to the neighborhood level, and we've got 5 years worth of all inpatient, outpatient, ambulatory care data on half the population of Norway. So we got together, we ran some things with them, we helped train them on Azure Machine Learning to look for, are there unrecognized patterns between weather and people with chronic disease? Now, frankly, we haven't found these great ahas yet, but I mean, we obviously came up with the obvious scenarios of, hey, when it gets cold and icy, you're gonna see more orthopedics, but we are starting to see some patterns they're looking more closely into around things like air quality and certain pediatric conditions. But back to that, if there are no boundaries to data, if you said, hey, what if we brought this together, and we can do it on an agile, cost-effective basis, that's the premise for what we're trying to do. So let me stop. Questions? Am I going too fast? Yes, sir.
I've been to the CeBIT last week in Germany. It's a fair, big IT fair, and I've seen IBM Watson and Hewlett Packard also doing stuff like that. So what makes Microsoft better than them?
Ooh. So let me repeat that. This gentleman has heard and seen of this thing called Watson, which, by the way, on a personal level, I love what they've done on a marketing basis. I mean, if Watson were a person, I'd want to take him out to dinner and have a drink with him. I would. I mean, so the question is, I think, paraphrasing, IBM's pushing what they call cognitive computing and Watson. How does that relate to the Microsoft strategy and approach and tool set, including Cortana Analytics? What I'd say is it's always fun and interesting to say, okay, instead of doing the bravado of the marketing wars, what I usually like to do is say, let's define a problem. Let's define a big problem that you care about, and then let's look at what Watson in theory can do versus Microsoft in theory what we can do. So that's number one. Won't mention clients, but we've got clients that they tout as their exemplars, including a major internationally recognized group here in America that just last week their clinical leaders came to us and said, can you help? So I think we're very competitive. Our marketing is not as, I don't think Cortana sounds as sexy as Watson, but when you look at our core functionality, I'm very confident that we not only stand up, but we exceed. The bigger question in my mind, because I get asked that a lot by a lot of clients around the world, is if I'm advising you as a client or you're a partner looking at who to work with, it really comes down to these questions of, first of all, look at anyone's model, ours, IBM, Oracle. First of all, to say, what is the business model for advanced analytics? How does it work as far as how the business arrangement's structured? What level of control do you have as an organization or client? Because there are some models where you're very dependent on the consulting services once you choose to go down a technology path. And Microsoft, as you know, some of you are partners. If you're a healthcare organization and you really want to outsource all of that, we've got a partner ecosystem to do it. But if you want to grow your own expertise inside, you can do that. And then finally, the third and obvious thing is pick any period of time and then map the total cost of ownership over that period of time for any one solution. And we find when organizations go through that process, we don't have the brand like Watson, but we usually stack up really well. Hope that answers your question. Any other questions, thoughts? Okay. Robinson, if you'd roll over to the other machine. So let's just go out and we'll play with some things and see if this, does anything to pique your interest. Okay, let's wake my machine up. Okay. I'm not a big fan. How many of you go into sessions and people are showing these cool things and talking about these cool things, and then when you say, God, that's really great, where's it in place and working? It's like, well, it's not. Well, what's the underlying technology? Well, this is really just, it's a mock-up of what it could look like. Hate it. So everything I will show you, real data. It's a demo based on real use cases somewhere in the world. So I always like to put that out so you don't think I'm faking things. So in this first example, and I'm going beyond machine learning now, because when we think of analytics and advanced analytics, kind of the peak of the Maslow triangle is often where predictive analytics goes. But there are 1,000 cool things you can do beyond predictive analytics. The beauty of Microsoft and the challenge sometimes is we have multiple ways of doing the same thing with multiple products. So sometimes just understanding, well, what product do I use? We make that confusing, and yet when you really understand it, it gives a lot of flexibility for how to do things. So the meeting I had before this, really cool group, there were a bunch of people on our campus called the Arctic 8. I thought that sounded like a music group or something, but the Arctic 8 are 8 countries, and America is driven by CDC. We had people from Canada that are the 8 countries that have Arctic regions around the world, and they're working on a cross-country initiative to say, how do we monitor what's happening in the Arctic regions that impacts both the health of indigenous people there, and then secondarily, as things are changing in the Arctic region with things like global warming, if you believe that, how does that impact the rest of the world? So it was a fascinating conversation around all the things you could use to monitor data, what types of data, how to predict. And a big part of the discussion this morning related to eventually geospatial analytics. So if you're interested in geospatial analytics, we have at least 3 or 4 distinct ways to do geospatial analytics. And the answer to, well, which one's right is depending on, well, what's the use case and how do you want to use it? So I'll show you one. So this is a healthcare organization that's a provider organization. So hospitals, they're a payer, so they have their own health plan, including they have the largest contract in their state for Medicaid, which is managing the insurance plans of poor people. So what they wanted to do is say, how do we do a better job of understanding how to manage the health of people already diagnosed with a chronic disease? So to do this, and everything I'm showing you in this case is simply latest version of Excel. So if you are doing Office 365 or the last two current versions of Excel and Office, you can do everything I'm going to show you. So they wanted to gather, back to erase the boundaries to data. So they had a lot of data in their EMR. In this case, their EMR is this company called Epic, non-Microsoft platform. And so what they did is they used a tool called Power Query to basically extract and index all the data out of the disease registries found in their EMR. So you look at the columns, if you can read them, smoking, diabetes, CAD, coronary artery disease, those are just all the people in the disease registries already with that diagnosis. And then they used the same tool to go out and grab external data. So down at the bottom, the tabs like parks, nursing homes, clinics, hospitals. They did all of that with one tool to index the data. Once they decided what they wanted to do, it took them about 2 days to actually bring what I'm showing you together. And then the other thing about this is, you know, a lot of times you can do cool things, but when you're resorting to things like C# programmers, but this is done by someone that has mid to high level Excel skills. So someone who frankly at a price point is fairly reasonable and easy to find anywhere in the world. So, you know, once they did that, I'm just going to go up, and this is just the toolbar of Excel. I could do the normal recommended charts, whatever. I'm going to go to 3D Map, formerly known as Power Map, and I'll click on that. And how many, by the way, are using or played with Power Map now? 3D, oh, cool. I'd love to hear your story. So the idea is now, remember those, you know, columns and tabs. Now what we're looking at is a starting point of where the critical mass of those patients are. And now we can start immediately doing cool things such as self-service research on demand. So let's say I'm looking at people with obesity. I simply select obesity as a heat map, and I get the distribution of where those patients are located within the service area. Now, two things. One, you can't do this with Epic or any EMR I know, and it gives you another view of where those patients are. Now, you know, if we play data science now, I mean, I usually get some oohs and ahs on that if you haven't used Power Map. But if we look closely, because we're trying to look at problem solving, doing better, what I see is a very even distribution of people with the diagnosis of obesity. Obviously, the orange, red are the higher densities. In real life, they can literally hover on the rooftop of every patient. For HIPAA and other security purposes, we anonymized the data, shifted it so I can get down to the census block level in this demo. So, you know, kind of cool, kind of interesting, but if I'm doing root cause analysis, and I say, okay, what if I took the internal data from the disease registry and I married that with data I can get from the US Census Bureau on per capita income by neighborhood? So, when I do that, I'm using the same data, and now I'm applying a filter of show me density by income by neighborhood. What I'm seeing is a very high correlation between higher levels of obesity in low-income neighborhoods. So back to what I was telling you, they have hospitals, doctors' offices, they're a payer, and they have the largest contract to manage Medicaid patients, and it's what's known as a per capita basis. So they get so much a month. If Nicholas were one of those patients on the plan, they might get $100 a month for the period of that contract. If they never see Nicholas, they get $100 a month. If he comes in every single day to the emergency department, they get $100 a month. So now all of a sudden, this is relevant from several levels. So if we just quickly, because I'm talking too much, let's pick a neighborhood. And again, all of this is real data. We didn't make it up. We didn't fake it. let's just pick a low-income neighborhood and start doing root cause analysis. Show me the location of grocery stores. Basically, what you see is what the literature often talks about, which is food deserts in low-income neighborhoods. Show me the location of fast food. I know for a fact that's McDonald's. I'm not sure if they're using Power BI or Office, but someone knows where to put fast food. If you look closely, show me the location of parks. What you see is the amount of open space in that part of the service area is far less than other places. Gyms, 24-hour fitness is not going to go into a neighborhood like this. But I can go on and on and on. But the idea is, now think about, I brought different data together very cost effectively. We're also really big on what we call self-service or research on demand. And so think about the skills required to do what I just did is I know how to read and I know how to use a mouse. So whatever you do in your business, I mean, what are all the data, if you brought it together, would be valuable to you or valuable to your client? And again, everything I just showed you, standard part of Office and Excel. If you said, hey, I want to do it a different way, I can show you at least 3 other ways to do geospatial analytics with different tools, including things like Power BI. So let me stop. Does it make sense? Any of you have some cool stories on what you've done? Yes, ma'am. Pretty easy. I mean, it would be fun. I have people much smarter than me actually building stuff, but we've actually, with some big clients, and particularly when we were first releasing this, would parachute in with some of our account teams into very large clients, and that'd be the cynical, I'd talk about raising the boundaries of data, and they'd say, oh, you're full of, it's like, can you give us some data? And we literally would go back to the hotel, and I had a really smart guy that I got to work with. It was really him. And we'd basically eat pizza and drink beer all night and come back the next morning and said, you know what you said couldn't be done? Here it is. And it's pretty cool stuff, and it's pretty easy. And for those of you who haven't explored it, there are lots of options, including let me know and give me your card, and we'll figure out how to connect you to figuring out how to do this. Any other quick stories on how you're using now 3D maps? Yes? Yes, you can. Yeah, I've seen some really cool work where, so 2 things. To answer your question, yes. And then there's another function up here where you can create a tour. So, and maybe I see some head shaking. What's really cool about this, if you have time series data, what's way cool is to say, hey, let me show you how that's trending over the last week. We haven't done it yet, but we're getting data hopefully in the next week from the health ministry from Brazil and Colombia, which are the 2 areas hardest hit by Zika. But we're looking at, how do we take the data they're gathering as they can on a daily basis. There's probably going to be a weekly time series to be able to show like a heat map of what's happening with the Zika outbreak. And then what we'd really like to do is connect it to their systems for reporting, so as there's a confirmed case, they could actually have visual controls to say, here's what's happening now, or drive let's look at the trend lines. But great question. Okay, I got a couple of other demos. Other quick questions or other quick examples of what you've done? Yes, sir.
Those capabilities will be available through Power BI?
Great question. The answer is there are some other ways to do geospatial Power BI, not this. So those of you who are even stranger than I am when it comes to following what Microsoft does. So originally Power BI was released, V1 had dependencies on Office and Excel. So I'd do presentations and people would love this, and it was technically, we called it part of Power BI. What we were really saying is to do this, you first have to have Office or Office 365, and then on top of that with licensed Power BI. I mean, honestly, and again, personal opinion, not Microsoft opinion, that wasn't a real smart model. We did that in part because we were trying to get something to market fast, but we took all of the learnings of the first year and we said, how do we repackage this? So that's where we separated Power BI from Excel and Office, including, within Power BI, if you've never touched a copy of Excel, you can still do all the data development and surface the data in Power BI on its own. I typically like to do the work in Excel because that's what I'm comfortable in, and then I surface it in Power BI. But Power BI originally was dependent on Office. It is no longer. It's a totally separate product. You can buy it without any dependencies on any other product.
Will I be able to do this in Power BI as well? Because at the moment I only have the globe map, which is a custom visual.
How about we take that offline? The answer is, can you do geospatial in Power BI? Yes. Not with this exact look, but you can. But again, let's take it offline. I'd love to follow up and give you a detailed answer. Okay. Yes, so the gentleman in the back, then I'm going to go to some other demos.
For this specific example, approximately how much time was dedicated to preparing the data?
Yeah, thanks. So how much time was taken preparing the data? Again, this organization has, I think, one of the best analytic teams in America. You know, if your skill sets are not as good, then it might take longer. We did some work with them, but essentially they wanted to do something. They were one of the early adopters of this. And essentially, you know, it took a couple weeks going back and forth to define, well, what do you want to do, and then what would be the data necessary to drive it. But once they had defined it, and then it was just a matter of going out and finding it, bringing it together. So it literally took, I'll say 2 weeks just to be safe. But that included not only finding the data, bringing it together, making sure it got massaged, cleansed to the extent it needed to, and then actually put into this where the first working model from the time they said, okay, this is the data, here's what we want to do, about 2 weeks. And then, you know, a little time to play with it. But the point is, it's agile. The developer skill level, and I'm not in any way being any of you who are great Excel developers, you're great, but it's just to say, the beauty is there are more Excel developers with skills out there, and if you're contracting, if you're hired Excel gun versus a C# programmer, the ability to be agile and cost effective using this tool is much better than many other things. Yes, sir, and then we're going to move on.
To emphasize what you're saying and answer this question, right now with the Power BI, if you're in a database world, you know what's the difference between schema on write and versus schema on read. So the schema on write is a traditional BI model. You need to use the ETL tool and staging area and then send it to the data warehouse. Now you don't need to do all this stuff. With the Power BI, you Power Query. You assemble data from the web, from JSON file format, from the cloud, Excel, Access, any data shape from norms in one single location. You can do it without having to need all those PDFs and it cuts development by some time.
I'm not sure if many of you could hear what this gentleman just said, who's from Scripps, but I think he just validated in real time what I was saying about the ability to be agile and cost effective. And I'm sure you'd be willing to chat with people after this session, right? Okay. Okay, I'm going to move on. Let's touch on, now that we've been talking about Power BI, let me show you a couple things. So I'll do some really quick things. So this is another example, real data, real use case where, again, in America, whether it's this thing called meaningful use, where a few years ago, our federal government came forward and said, you know, the answer to fixing healthcare is everyone should have an EMR, and we're going to take $19 billion in your tax dollars and incent hospitals and doctors to have EMRs. And in order to get the money, you have to show you're using an EMR in a meaningful way. So there are certain criteria you're measured on, and there are also these things called value-based payments. So if I do a procedure on you, I may get paid X, but if I can demonstrate quality, I can get X plus something else. So quality measures, particularly on an ambulatory basis, are huge as far as quality and economics. So this is an organization that said, hey, we want to have in one place a centralized portal for all quality measures that any of our people can go out to and look at how we're doing, particularly those who are responsible for certain quality measures. And our leadership team have this dashboard up in their executive meeting room as visual controls. They can walk in at any time and see what's going on. And if something's not going well, you might get a call. I mean, that sounded negative. It's not, but it's just to say, how do you create these dashboards where rather than saying, hey, we're closing the books, you know, it's the end of the month, let's close the books, and let's do the normal thing where 30 days later, I'm bringing you data that shows we're really sucking at quality control for diabetes or something else. How do you do it real time, near real time? So what they did is they defined all the quality measures. In the real one, it's, they've got about 109 or 11 quality measures. But the idea is you can go out there and look at the major things such as diabetes, breast cancer screenings, on and on. In meaningful use fashion, everything's measured in a numerator, denominator. They said, let's have it right up there out front for everyone to see. So we quickly can look at, okay, diabetes, there's this test called A1C. The goal is 70% of people already diagnosed would have an A1C level of under 8%. And what we see is that only at 52% in this model, I can quickly go out and start looking at a lot of things at a glance, such as, you probably can't see this, but the horizontal is communities and the size of the diabetic population. The vertical is compliance, and what I see is, you know, there are certain communities in the service area doing better. I can click on it, and I apologize, the connectivity in here is dreadfully slow. And drill into progressively deeper levels of information. In this case, if I can look at how we're doing on diabetics by payer, by gender, by age. Anything I click on is going to take me down to a deeper level of whatever I'm looking for. Here's a deeper level of how we're doing by, again, sub-community within that service area. If I click on something like Central Iowa, it's going to now show me all the information, because Central Iowa has a very high population of diabetics, very low compliance. So I'm doing root cause analysis. I want to know which doctors, which clinics do I need to go have a chat with to get them to improve, because one, it's poor patient quality. Two, it's probably costing me money. So in the case of this demo, we can get it down to the communities. In real life, they can literally point and click their way down to the clinic level to say, here are the clinics with the highest number of diabetic patients, lowest compliance, and they can click further down to the physician level to say, of the 1,000 physicians that have privileges in my organization, here are the top 20 with the highest number of diabetics, the lowest performance. Gee, now I've got a call list. I can go out and say, hey, let's have a chat. Not only have a chat, and any of you who've ever gone out to talk to a doctor and you're not a doctor about their quality, that's not fun. The ability, though, to go and say, hey, Dr. So-and-so, I'm looking at this data, and you know, can you help me understand what's going on? Because here's your data compared to your peers. Can you help me understand? Much easier conversation. I'm a former hospital executive. I've had those conversations, and I've got the scar tissue to prove it. So the other thing, and maybe, yeah, we've only got 12 minutes. Let me do one other thing. And for this, yeah. So I think one of the coolest things we've done, and again, standard part of Power BI, is natural language processing applied to big data in the cloud. So many times I hear people talk. We were having a conversation with someone else back there about another company called Tableau. Great company, great service. I know some of the guys there. But the ability to take any tool and bring it into healthcare, like with clinicians and executives, say, hey, we really want to create a data-driven culture. And what that means is I'm going to put you in a classroom for a half day to do training on this new tool for analytics. What do you think? And even if you can get them in the classroom, I don't know if you're like me, but I'll do training. I'm not bad at this stuff, but that'll be on a Friday. I come in Monday after not using it, and I put my hands on the keyboard. It's like, now, how did that go? The ability to say, well, what if I can show you the easiest way of no tools required to do research on demand? So what I'm showing you now is a little dashboard. So I use this. How many of you use Power Query? Anyone? Okay, great. So we use Power Query, and we went out and found several really cool databases that are part of open government initiatives. What I'm going to show you is from actually University of Pittsburgh, but they grabbed CDC data. So what we did is we took all disease incidence data in America, which they've kept track of on a weekly basis by county back to 1888. So would anyone agree that's not big? I mean, I think that's big data. So we used Power Query, we indexed. So if your mom or your grandmother had a case of meningitis in 1942, she's in the database. So we used Power Query, we indexed it. Took us about a half day to play with it. And then, we were able to then start using natural language processing. So this is the dashboard where I just created a few things. But if I go up here, so let's pretend I'm a disease researcher looking at disease trends over the last century in America. I'll go up, and if my connectivity is working, and type in disease, it immediately brings me back a list of all diseases that have been tracked since 1888. It's also got machine learning built in. So in theory, the more I use this, the smarter it's going to get at anticipating what I'm looking for. So when I type disease, down below it's saying, hey, you might try show disease. And it's just like a search engine. There are times where you play and you don't get everything you want, but if I do disease by, case, again, look at how fast that is. On a slow connection. So it's going out, it's going through 130 some years worth of all disease incidence data, and it's bringing back not only the answer, but a visualization it believes is the best way of representing it. So as a researcher over the last century, what I'm seeing is measles has had the greatest impact as far as number of people affected or infected over that time period. So that's kind of interesting, but it's a long time period, and I know this data was provided on a weekly basis. So then if we go and do something like disease, what do I want to do? Disease by week beginning and cases. Okay, so here's what's interesting. It's telling me how I might do a better job in the machine learning. 2 weeks ago when I did this demo, it was presenting a different visual, a better one than this, frankly. So this is giving me an answer, but the chart, the data is there, but I can't see it. So it thinks it's doing a better job, but it's not. So I can do one of several things. I can go over here and go, okay, I can just click on visualizations to say, I really want that in a line chart, and there it is. And I won't go through a long spiel, but if you look at all these things, they're different diseases. This thing where there are these big spikes, that's measles. So it had the greatest impact on the American population, but there was a period of time for many decades where it was a non-entity, and then it became a big deal, and then it wasn't, and then it became a really big deal. And so if I wanted to further explore that, I promise I'm not going to hold you hostage, but if you can't tell, I love data. If we did something like quickly, what do I want to do? Measles cases by year. It's now showing me that in a different view. And the cool thing about any of this, or if I said, nah, let's do a different visualization, and let's say that's the one I like, that's the one I also want to share on my portal for the other researchers. I click pin, I select pin, I go back to the starting point, and there it is. If I really want that to be more dominant, I'm going to drag it up here. Natural language processing applied to big data in the cloud. And again, my skill level, I can read. I kind of know how to use a search engine, and you can do some pretty cool things. Let me stop there. We've got about 6 minutes. Again, makes sense? Any of you working with any of this now, including Power Q&A?
Is there any way you can build taxonomy?
Say that again.
You can build a custom dictionary taxonomy for your question?
Yeah, there are different ways of playing with the underlying data that makes your search more efficient, and you can manipulate it, and it doesn't take that much. It's a lot of trial and error. Yes, sir?
Is the Power BI covered under Microsoft's BAA, Business Associate Agreement?
It is on the cusp. So the question is Power BI covered under the Business Associate Agreement, which is a requirement in the United States for HIPAA? So let me give you a broader answer. So Cortana Analytics is a series of things. Everything in Cortana Analytics is on the path to be covered under the Business Associate Agreement. So some things like Azure already done. I honestly don't know the answer. It was supposed to be certified for coverage under BAA, Power BI. By now, I'm not sure if that deadline slipped or not. But I'd be happy to give you an exact answer and email you. But great question.
According to our account manager, it is covered.
Then let's go with that. I love that answer. No, so I'm never going to give you an answer on something like security and compliance that I don't know absolutely. It was supposed to be, but there are times where you've probably never seen this. Microsoft has a deadline and we miss it. You've never done that, I bet. Any other quick questions? Okay, listen, thank you so much. Would love to hear from you if you've got thoughts or examples of how you're using it, but thanks a lot.